Alzheimer's disease is a progressive neurodegenerative disorder that affects millions of people across the world, and sporadic Alzheimer's is the most common form of the condition. It develops gradually over time and is not directly inherited from family members. Instead, it arises through a complex interaction of age-related biological changes, environmental influences, and lifestyle factors. These processes collectively lead to the gradual loss of neurons, which results in cognitive decline, memory problems, and noticeable changes in thinking, behavior, and emotion. Sporadic Alzheimer's often begins subtly. One of the earliest signs is short-term memory impairment, such as forgetting recent conversations, misplacing objects, or struggling to recall new information. Individuals may start having trouble with planning or problem-solving, such as managing finances, following a recipe, or organizing daily tasks. Language difficulties can appear, including trouble finding words or maintaining conversation. People may also become disoriented in familiar places or forget the time or day more frequently. Emotional changes, including irritation, anxiety, or shifts in mood, may become more prominent as the disease progresses. Over time, these symptoms lead to increased reliance on others for everyday activities, eventually affecting independence and overall functioning. The incidence of sporadic Alzheimer's increases significantly with age. While it can appear earlier, it is most often diagnosed in adults over the age of 65, and the likelihood continues to rise as individuals grow older. With the global population aging, the number of people affected continues to grow, making Alzheimer's one of the most significant public health concerns of our time. The neurological changes underlying sporadic Alzheimer's are well documented. A hallmark of the disease is the buildup of beta amyloid plaques, which accumulate between neurons and interfere with communication. At the same time, tau protein tangles form inside neurons, disrupting the transport of essential nutrients. Together, these abnormalities damage and eventually kill brain cells. Key regions of the brain, such as the hippocampus, which supports memory formation, and the cerebral cortex, responsible for reasoning, judgment, and language, are especially vulnerable. As these areas deteriorate, the cognitive, emotional, and behavioral symptoms of Alzheimer's become more pronounced. A variety of factors increase the risk of developing sporadic Alzheimer's. Age is the strongest factor, as natural changes in the brain make it more susceptible to damage over time. Chronic inflammation, cardiovascular issues such as hypertension or high cholesterol, and metabolic conditions like diabetes all contribute to heightened risk. Lifestyle also plays a significant role. Diets high in processed foods, lack of regular exercise, limited mental stimulation, poor sleep, and prolonged stress can elevate the likelihood of cognitive decline. Environmental exposures, including air pollution and toxins, may also play a role. Importantly, risk does not guarantee the development of Alzheimer's, but it helps explain why some individuals are more vulnerable than others. The progression of sporadic Alzheimer's varies from person to person, but it generally follows a predictable pattern. In the early stages, memory lapses and mild confusion may be manageable, allowing individuals to maintain independence with minor adjustments. As the disease advances to the moderate stage, cognitive impairment becomes more noticeable. People may struggle with daily living tasks, have difficulty recognizing familiar people or places, and show more pronounced personality changes. In the severe stage, communication becomes extremely limited, physical abilities decline, and full-time care becomes necessary. Diagnosis involves several steps. Clinicians begin with cognitive assessments to evaluate memory, thinking skills, and functional abilities. Brain imaging techniques, such as MRI or PET scans, can reveal structural changes or abnormal patterns associated with Alzheimer's. Biomarker testing, which measures amyloid and tau levels in cerebrospinal fluid or through specialized scans, offers additional evidence to support diagnosis. Together, these tools help identify the disease and rule out other conditions that may mimic its symptoms. Although there is currently no cure for sporadic Alzheimer's, a combination of treatments can improve quality of life. Medications may help stabilize or temporarily improve cognitive symptoms. Cognitive therapies, memory training, and structured routines can support daily functioning. Physical exercise, social engagement, and a healthy diet also play important roles in maintaining brain health. Support from caregivers, family, and community resources is essential, as the emotional and practical challenges of Alzheimer's affect both individuals and their loved ones. Future research offers hope. Scientists are working to develop disease-modifying therapies that target the underlying biological changes, including drugs that reduce amyloid buildup or prevent tau tangles from forming. Advances in early detection aim to identify Alzheimer's before symptoms begin, which may allow for more effective intervention. Personalized approaches that consider genetics, lifestyle, and individual risk factors are also emerging as promising directions. Ultimately, ongoing research seeks not only to improve treatment but to prevent or cure Alzheimer's entirely. Supporting individuals living with Alzheimer's is crucial. Compassion, patience, and understanding can greatly improve quality of life for both patients and caregivers. As awareness grows and research progresses, there is increasing hope for better treatments, earlier detection, and a future where Alzheimer's disease is more effectively managed and eventually prevented.